You know, it occurred to me, I don't really talk about eyelid surgery very much. It's kind of interesting because it's one of the most common procedures that we do. I guess I always kind of think of it as being small or sometimes simple, especially upper eyelid surgery. And all we're really doing, and this lady did not have it, but if there's extra skin, we just sort of measure how much there is, make a lower cut, an upper cut, sew it together, and the scar ends up right in the crease. Lower eyelids, though, they get a little trickier, so I want to talk about that. Usually, when we're seeing someone for lower eyelids, it's for bags right under the eyelid. So how do I get from here to there? Well, there's so many different lower eyelid operations. I really tailor it to the simplest way to get to the result for the patient. And what I'm looking for is taking this long lower eyelid appearance and giving the appearance of having a shorter lower eyelid, because that's what it looks like when you're young. And another thing is, I mean, there's pretty obvious bags, right? You can even tell from this patient there are different fat compartments, even without knowing the anatomy. Well, I'm trying to smooth that out too. So those are the two main things I was trying to do in this lady. How did I actually do it? Well, we took some fat from somewhere else and did some fat grafting here on the outside to fill this groove, which I call the lid cheek junction. And once I blend it in that way, then I go in and try to do the same thing from the inside. Incision back on the back side of the eyelid by the eyeball, come in here and take out a little bit of this fat, and then this bulge here, I'm actually moving, lifting up this tight attachment and putting some of that fat, pushing it down into the groove and suturing it there. So I'm pushing fat in from the bottom, underneath, and I'm grafting fat on top, trying to make a very smooth contour and a higher cheek instead of a flat cheek and a bulge, trying to get just a higher cheek, less eyelid, and a smooth curve.